What started out as a blessing for Neshell Brown and her family has turned into one unresolved problem after another.
Everything I've complained about since I've been here is like they don't even try to fix.
After an exhaustive search full of denied applications, this mother of three was approved to move into this Government Hill home on the city's Near East Side, a home that has its fair share of maintenance issues. Why'd you move in?
When we first moved, it was so hard to find like a place that would work with like our background. Like I have I think it's like 3 years old now. It's a 3-year-old eviction.
Gainfully employed now and current on her rent,
I'm paying $975 to live in something like this.
Brown is on track to improving her rental history. She just wants property managers to make some much-needed repairs, starting with this large hole in her children's bedroom window. She says it's been like this since she moved in 4 months ago.
With all this child trafficking, like what if someone comes in my house and takes my kids?
The tub, discolored with black and brown stains, needs to be refinished and has exposed insulation around it.
The tub is horrible. I don't know if that's rust or whatever it is, but they could have replaced that before I came.
She says it constantly needs to be plunged, just like her toilet.
It's been clogging up since we moved in. You know, it really doesn't unclog.
Areas of her floor are caving in, leaving dangerous exposed nails.
It's very dangerous, and I feel like me nor my kids should have to live in something like this.
We took her concerns to code enforcement. Officers wasted no time conducting an inspection and issuing a notice of several violations, including plumbing and flooring issues.
I need them to either come fix everything or give me everything I put into this house, all my money back, to move.
We reached out to property managers who now have 11 days to complete repairs or face fines for each violation. They tell us they will work with the city to make the necessary safety improvements and repairs.
My kids have to bathe in this.
It all gives Neshell Brown hope that her living conditions will finally improve.
I don't want to move because I love my neighborhood.
We're seeing COVID. COVID is here in San Antonio, and it's on the upswing, and it's serious.
As we continue the path forward through the pandemic, the medical community is begging you to please keep taking the virus seriously. News 4 San Antonio's Amanda Henderson shows you why doctors and elected leaders alike are worried people are letting their guards down.
San Antonio's COVID-19 dashboard paints the picture of our fight against the virus. Our hospital and case totals are trending the wrong way. The most recent daily case count, 1,241. The increase is largely led by the Delta variant, which is something Dr. Stephen Ramirez says is not surprising.
We're not playing with the same player that we played with the Alpha variant last year. This is a different virus. So last year's virus was Pee Wee football, and this is an NFL linebacker. Very different.
When it comes to COVID-19 cases, we've been seeing an upward trend not only here in Bexar County, but across the entire nation. And doctors say that it's going to take more than what we've done in the past to ensure that this trend goes down.
Unless we change our way of thinking about this virus, I'm worried that the numbers are only going to go up.
Something else that's different from last summer's surge to this latest one, how people are reacting.
We can call it lots of different things. COVID fatigue. We could just say that we're sick and tired of the virus. And we've been here before many times.
Dr. Ramirez says he is respectful of patients wanting their health to be their choice, but he does emphasize the need to stay alert.
If everyone wore a mask, practiced social distancing, stayed home as much as possible, and got vaccinated when they could, San Antonio has a chance to get through this less unscathed. But I still expect San Antonio to deal with this virus.
Bexar County Judge Nelson Wolf gave a passionate plea about the importance of being vigilant.
We have to do a number of things when we're in a car. We can't text. We got to have turning signals. We can't speed. We got to have seatbelts. Why is that? It's because it's protecting you and someone else. That's exactly what the mask does.
Now, the mask mandate starts on Monday, but it's a temporary one, at least for now. Here's what happened. The 5-1 vote will now mandate masks for all NEISD campuses, school buses, and facilities while indoors. It comes after there was a spike in cases reported over at Castle Hills Elementary, and our city is averaging nearly 1,600 new cases reported every 7 days. Now, the board meeting, which lasted about 6 hours, had school board members listening to about 150 parents, a lot of folks out there. They wanted to give their input on enforcing masks. Most were very passionate about why they do or do not want a mask mandate. Take a listen.
As administrators, as teachers, as board of directors, it is your job, it is your moral responsibility, your ethical responsibility, sometimes your legal responsibility to do everything that you possibly can to protect these children.
Instead, it's the adults who are forcing children to cover their faces for the purposes of comforting the very people who ought to know better. We are frightening them into believing they're being stalked by invisible menaces lurking in the air and that everyone around them is sick and a potential threat. What kind of psychological damage are we inflicting on them by doing this?
Now, the district and board plan to revisit this topic a little bit later on, although no exact time frame was given.
Right now, nearly 1,400 people with COVID-19 are staying in area hospitals like these in the medical center. It's not a record, but it's close. And in addition to all the COVID surge patients, doctors and nurses are also having to take care of everyday emergencies too.
Excuse me.
45-year-old Michael Shackelford started feeling kind of sick after the 4th of July weekend. He got worse over the next few days.
I eventually went to St. Luke's Baptist Hospital in the medical center at the ER.
Shackelford tested positive for COVID-19 and was admitted. He wasn't the only one.
I saw them in the back of the ER. They were just, gurneys were lined up and they were just waiting to get into a private room.
Crowded emergency rooms are a common sight in hospitals all across San Antonio.
I've been inundated with COVID patients that they've been waiting in our ERs for days to get a bed.
The number of available hospital beds has been dwindling over the past few weeks.
On any given day, we have about 4,500 staffed beds. Yesterday around 11, we had about 270 of those that were available.
The South Texas Regional Advisory Council oversees hospitals in Bexar County and the surrounding area. STRAC's director, Eric Epley, says there is a simple fix.
We have beds. We have the capability in the hospitals. We're just short the staff.
Yesterday, about 300 nurses from out of state arrived at San Antonio hospitals to help combat the surge.
And we are actively ordering the next round, which we hope will be here early to mid next week. And so that's another about 315 additional nurses.
And when those extra nurses arrive, hospital leaders hope that'll stabilize things. And think of all of this like the grocery store checkout line. When there's only 2 checkout lanes open, lines back up. But when more staff show up and 2 or 3 more lanes open up, things work a lot better.